Okay, today I am going to be demonstrating and explaining how to correctly put on a bandage for a wound for Kinesiology 220. So the first thing I'm going to talk about is disease prevention. You want to make sure to wear gloves as you are treating a wound because you don't want disease to spread from hand-to-hand contact or hand to skin or whatever, something like that. You want to make sure to wash the area with soap and water as soon as you are done treating the victim because you don't want anything seeping through like cement or grass or something like that and touching another person that could potentially harm their body and cause them to have some kind of transmitted disease. And then if any eyes, nose, or anything in your mouth was exposed during this, you need to thoroughly clean with a lot of water. The second thing I'm going to be talking about is how to properly assess the victim whenever they are laying on the ground or sitting down and they're visibly hurt and bleeding. So the first thing you want to do is perform a primary check. So you want to ask what happened, and then you want to say like, where are you hurting? Because you want to figure out if they're hurting on their like anything on their arm or their leg or anything on their stomach, just so you can kind of get a general area of what is the matter and what is hurting. So then you want to scan the body and see if anything is bleeding severely. If something is bleeding severely, you need to call 911 immediately. The second thing you want to do is perform a physical exam. So a fun little acronym to think of, a checkoff list of things to do would be DOTS, D-O-T-S. So you want to check for deformities, open wounds, trauma like tenderness or pain, and then swelling. So if anything like that is going on, you need to make sure and check those out immediately. Number 3 is you need to obtain sample history, and this is another acronym standing for, you need to look for signs and symptoms, allergies, medications, pertinent past medical history, the last oral intake, and then the event leading up to the illness or injury. So the next thing, to control the bleeding, you're going to want to use some type of gauze. Okay, let me look for my gauze. Okay. Kelsey, Kelsey is my friend here, and she is going to help me demonstrate how to bandage a wound. So we're going to use her nice little hand and wrist for this video today. So whenever you're wanting to stop bleeding, you're going to place the gauze onto the hand. Make sure you have on some kind of gloves, or if you don't have any gloves, you can use paper bags just to help prevent any of that, because it goes back to the any type of disease prevention. You don't want that to happen. So say here Kelsey's hand is bleeding. We want to apply the gauze directly on top, and I'm going to use my fingertips or the palm of my hand to apply direct pressure onto that surface that's bleeding. If the dressing becomes, like if it soaks up really quick, never take off the gauze because that can harm her skin. So you want to continue to apply more gauze on top of the bleeding spot and keep applying direct pressure as well. So wound care. Today I'm going to be showing you how to do a figure 8 type of bandaging. And I have my nice little wrap here. So first, I'm going to start off with anchoring the bandage. So I'm going to loop this around once or twice. It just depends. Usually I like to do it one like tight time so I can continue to go on top of it. So anchor the bandage with 1 or 2 turns around the palm of the hand. You're going to carry the bandage diagonally across the back of the hand and then across the wrist. So I'm going to diagonal across. And I'm going to diagonal across. Okay. So repeat the figure 8 maneuver as many times as necessary to cover the dressing, overlapping wraps to stair step up the hand. So this one's kind of short, but eventually it would continue to stair step across up her arm. So it just creates more security in that. But so that's kind of how you bandage this kind of bandage. There's all kinds of different things, but I just wanted to demonstrate this type of bandage for you today. So then we need to think about wound care. I kind of already described like how to like soak up the blood and stuff like that. But for caring for the wound, you need to make sure to wash your hands, to flush out anything that is on your hands, like that. But for cleaning up, you want to use soap and water again to clean the area that is on the ground, because you don't want anything to seep in between the surface and any part of the skin. You want to use absorbent barriers to soak up blood or other infectious materials. Clean the spill area with soap and water, 1 to 2 dilution of different type of substances. You want to discard contaminated materials in an appropriate waste disposal container. So kind of like how I explained a couple weeks ago about how to dispose of gloves correctly, you want to do the same thing with the things you have used when dealing with this wound and bandaging it. You want to make sure to throw the gauze away, and possibly even the ACE bandage. If it's super bloody, you want to dispose of that in a plastic baggie and then throw it away, because you don't want to risk any type of transmit diseases in that way. So that is how you bandage a wound. Kelsey, thank you so much for your help. I hope you have a great day.